Hello, my name is Eric Burton, and I am interested in a clinical rotation with Venture Physical Therapy. One of the core values I connected with is embrace failure to get better. See, I find that the best way to learn or perfect a new skill is to allow yourself to fail, and to fail, and to fail again. In order to do that, it's important to have a safe, low-consequence environment that we can practice in. I believe that as a physical therapist, it's an important part of our role to create that safe and controlled manner for our patients to practice and fail and get the repetitions in. When we practice the small stuff a lot and fail, we can do the big stuff pretty darn well. Another core value I connected with is the creation of community-centered healing. I've had the opportunity to be a part of a few of these communities. The first one was during undergrad. I was with a physical therapist who ran a group fitness class for people with Parkinson's disease. And, the group fitness class was important. We worked on balance, we worked on strength, things that you'd want to address for people with Parkinson's. But it also filled a community and social need for those participants, and I believe that's not something to be overlooked. A community I'm taking part of right now is Oregon Adaptive Sports. And while it's not necessarily healing as the main goal, it's more focused on athletics, getting people with disabilities onto the mountains, either riding snowboards, skis, sit skis. It's not necessarily a healing community, but I do believe that getting people the opportunity to push themselves and take a bit of control and have a bit of an adrenaline rush and do athletics does have a therapeutic effect. And I'd consider that community healing. As for why I would want to start a career in Hawaii, well, it's my home. As a kid, I was taking my lumps out at Sandy's and Mox. As a teenager, I got lickings on the North Shore. And even to this day, any chance that I can to get back home, get up to the North Shore, catch a couple of waves, I'm jumping on that. Although I do have to be honest, I'll probably be living and working on the mainland for a few years before I come back home and work in Hawaii. And for clinical sites, I am most interested in the neuro site on Maui. I do have some interest in the Lanai rotation, but I have some reservations. I know they have a pretty small population out there, and so if you think I'll be seeing a pretty good amount of people and a good variety, which happens with rural, I'd love that rotation. But if it's a lot of downtime, I think I'd actually want to avoid that one. As for the rotation dates, I'm available during my winter term, which would be my second rotation, January 6th through March 21st, or spring term, my third rotation, March 31st to June 13th. Thank you.